Hi, I'm Vaibhav Singh, co-founder and managing director of ETHealthworld. So when we talk about health coverages, especially in countries like US, UK, Canada or Germany, you would see in US roughly 300 million people would be covered out of the 330 million population. In Germany, the entire healthcare coverages is being sponsored by roughly 80% is being sponsored by the government, and remaining 20% is for the private players. In US again we have a universal health scheme like NHS. In Canada also we have a universal health scheme. So that's the kind of attention which has been given when it comes to health coverages and globally. In US I believe roughly 20% of the GDP is being spent in the healthcare expenditures, versus in other countries it ranges, in any developed country it will range in from 12% to 20%. So that's the importance which we are seeing in the when it comes to covering health benefits for the population in different countries. When you talk about health coverages in India, you would find that the non-government insured people would be roughly in the percentage of 10 to 12%, and the percentage which we spend out of a GDP is around 2.5%, which is 1/10 of what we see in the other geographies, in the other developed countries. That's one. Second part, when we see the coverages also, what are being covered, if there is any health insurance or health coverages available, that would only cover people when they get hospitalized for 24 hours or more, which is only catering to them when they get very sick and very serious. On the other hand, when we see the expenditure borne by the individuals out of pocket, that is more than 62%, and out of which majority of it is on the primary health care. So if you combine all the data points, you would find that there is an underlying need of a primary care coverage which is not being currently accessible or currently not being offered to the end individuals today in India. Seeing this gap, there is a clear opportunity for someone to fill this gap and cover people from the time they wake up before they get hospitalized, which is more to do with their day-to-day health management, more to do with their OPD benefits, more to do with their mental health, more to do with their fitness. So that's an opportunity which is clearly visible and which is clearly open for anyone to come and fill this gap and ensure that the accessible healthcare, especially on the primary care side, reaches millions and millions of Indians. And this is also quite evident if you see the number of players, number of founders, entrepreneurs who are coming to bridge this gap. We have seen players who are focusing on mental health, who are focusing especially on fitness, who are focusing on OPD management. So that's a clear trend which you see in the last 6 years. The number of healthcare startups which have come in India to solve this gap of a holistic approach rather than just a hospitalization approach is clear indicator and a testament of the fact that people are realizing the need, people are trying to solve this problem from some way or the other. They might take different routes to achieve their vision, but the final vision for majority of the healthcare partners, if you see, is to just ensure that millions and millions of people who are deprived of a holistic healthcare benefit should be given in some way or the other. They might go to a different, their execution could be different, their go to market could be different, but ultimately that's the fundamental problem which has been analyzed through data, through trends. COVID has been a very big strong tailwind and a very big testament to this fact, which has made us realize that if we don't take care of the primary healthcare well before, the kind of force and the kind of attack we are going to do on the secondary healthcare will make it crippled. Anyway, it's not in the best state, and when we leave the entire gap and everything goes to the secondary piece, whatever we have will also be of very less use especially with the population we are in. So rural areas, there's no accessibility. Urban areas, people would have to take a half day off if they want to consult, if they want to get any healthcare need. So the problem existed both ways. And these are the people, especially in urban areas, who are habituated of using apps like Myntra, Ola, Uber, Zomato. Their lives had changed in other spectrums. But when you talk about healthcare, what Myntra is today for fashion, there is nothing for healthcare. What Ola or Uber is for commute, what is that for healthcare? So that's the piece which is clearly, which is a clearly missing point. So that's how we figured out that there is a very big gap, and then we saw the coverages part, that what are the coverages available, how it's currently being. We started digging more, figured it out that primary healthcare was totally vacant, coupled it with the data which are talking about the healthcare expenditures and the kind of categories of expenditures people are doing. So everything was just directing us to one point, that there is a very big need for a holistic approach towards healthcare, towards making it accessible, and especially filling the primary wellness and the primary healthcare need. So with that idea, we started building Visit, and when we were building, we realized that either we could go to the consumers directly, or we could go to the consumers through a different and a trusted channel partner. That's when we realized that this problem, we should solve it for the corporates first. And while we'll be doing it for the corporates, the learning curve will also increase for, for young entrepreneurs, the first time entrepreneurs. We started in our final year. So we had never worked before in any corporate. We had very less knowledge about how the corporations work. So keeping that in mind, we started building platforms. We started building Visit app, especially to cater for corporate audience, where corporates, again, this problem exists everywhere, whatever benefits are being given. So in corporate, especially, mental health was something which has always been the talk of the town. So initially, when we started building our suite of services under Visit umbrella to cover the primary care, we started with mental health programs. So we were more of an employee assistance partners for corporates, which would help employees get mental well-being, which would help employees get psychologist consultations and so on. Over a period of time, since the ultimate goal and the vision was always to cover the entire holistic approach, we started adding more and more benefits. The next jump which we took was on the day-to-day wellness, which is getting your metabolic profiling, your HRA, your tracking steps, your diet plan management, and so on. This was something which we established, and we were lucky enough to have IBM as our client. So we were just a 16-17 member team, and we were competing with the who's and who's of the world and from India as well. But because of our tech infrastructure, tech capabilities, the customization, the flexibility which we had, IBM finally chose to, chose to go ahead with a company like, early stage startup like Visit to help their employees manage their health and well-being. So that was one of the very, I would say, biggest achievement at that point of time. The latest addition in our entire suite of services, which was the last nail in the coffin, was the OPD program. So we had covered the wellness piece, we had covered the EAP and the other telemedicine piece. The extension of telemedicine, which is OPD, was the last, and anything beyond OPD comes into the IPD, where the program and the benefits already exist. So OPD was one which, and today when we talk about OPD, we have created our own proprietary network of roughly 31,000 doctors who are sitting in the OPD departments of doctors or in your neighborhood clinics. So these are scattered over more than 1,200 hospitals and clinics. We have a cashless diagnostic chain of which covers roughly 4,000 plus pin codes. We have more than 750 plus radiology centers where our users who are subscribed to it can go and get any of the radiology tests. We have pharmacy network available for more than 7,300 plus pin codes. In fact, we even have 3,600 plus pharmacy stores where we have tied up, where any user who is a part of our program, which covers pharmacy as well, could just walk into that store, show that ID, and get all their medicines which are prescribed basis obviously the policy eligibility and everything. So we have covered OPD, we have built, and with the network, cashless network piece, and the reimbursement, even if it's a reimbursement program, let's say for that matter, the efficiency which we bring, the digitization and the efficiency which we bring on the table, kinds of give confidence to the insurers and the brokers to even write OPD and pitch OPD as a standalone product and not just a rider with the IPD one. So in this journey of over 6 years when we started, we have been funded, we have been backed by some great names of of the society. From India, if I talk about, we were backed by Snapdeal founders Kunal and Rohit. We were backed by MapMy India, who was our first investor. We were also backed by Muthu Murugappan, who's from the Murugappa group. And when we talk about Silicon Valley, we were the first investee company of Twitter's co-founder Bistone. So we also got Chief AI Scientist of Salesforce, Richard Socher, as our investor. So be it India or Silicon Valley, we got some marquee names on our cap table who were who agreed to support us in our vision of filling this gap. And obviously this would have never been possible without the support of the clients. So today we stand with more than 200 plus mid and large corporates where we have helped them design primary care and wellness solutions for their employees. We have over 2,000 plus SMEs where we have deployed our product. So ranging from software companies like IBM to manufacturing companies like JCB, from startups like Swiggy and Dream11 to legacy companies like Times of India, from blue collar workers of JCB to even the white collar workers, white collar employees of Rolls-Royce. So if you see, because of the breadth of the services which we have and the customization and flexibility which we bring on the table, it's not focused on any particular demographic of population. It can cater to anyone, irrespective whether you're a young crowd, you're middle-aged, or you're a chronic care person. You'll have something or the other when you come on Visit app. So that's one of the key differentiator, and that's the reason why we have been an engaging platform as compared to any other players in the market who have only focused on particular use cases.